Hello everyone, welcome back to our channel. Today, we're diving into a very important topic that can save lives. Heart disease is the leading cause of death globally, but did you know that your body can show early warning signs even a month before a potential heart event? Especially for those over 50, recognizing these signs early can be crucial. So, what are these early warning signs of heart disease that we should be looking out for? Heart disease is incredibly dangerous, claiming millions of lives each year worldwide. According to the World Health Organization, heart disease is responsible for approximately 17.9 million deaths annually, which accounts for about 31% of all global deaths. This staggering statistic highlights the importance of awareness and early detection. It's essential to understand that the causes of heart disease, such as high blood pressure, cholesterol buildup, and lifestyle factors like poor diet, lack of exercise, and smoking, are interlinked and can compound over time. Awareness is the first step towards prevention. If you or someone you know is experiencing any unusual symptoms, it's crucial to consult a healthcare professional immediately. Simple lifestyle changes such as eating a balanced diet, regular exercise, and avoiding smoking can significantly reduce your risk. Additionally, regular checkups and monitoring your heart health can help catch issues early. So, stay tuned as we delve into the 10 early warning signs of heart disease you should be aware of. Let's get started. 1. Purple nails and lips. Blue or purple nails and lips occur when fingers or lips turn blue or purple due to a lack of oxygen in the blood. This happens when the blood does not receive enough oxygen, causing thin-skinned areas like nails and lips to appear bluish or purplish. This can be an early sign of serious heart problems, especially in people over 50. A lack of oxygen in the blood can be directly related to many issues, including ischemia, where part of the body does not receive enough blood and oxygen due to blocked blood vessels or the heart not pumping enough blood. Additionally, heart failure, a condition where the heart cannot pump enough blood to meet the body's needs, can also cause this condition. Furthermore, heart valve problems such as valve regurgitation or valve stenosis reduce the heart's pumping efficiency, leading to a lack of oxygen and cyanosis. Chronic lung diseases like COPD can also cause a lack of oxygen in the blood and lead to this condition. Notably, a right-to-left shunt, a condition where blood bypasses the lungs and does not receive oxygen before being pumped into the body, commonly seen in congenital heart diseases, also causes cyanosis. Blue or purple nails and lips are important signs indicating that the body is lacking oxygen and may be early signs of serious heart problems. Recognizing and addressing this condition early can help prevent dangerous complications and improve quality of life. 2. Chronic cough. Chronic cough is a condition where coughing persists continuously, often as a dry or productive cough with mucus, and does not subside after several weeks or even months. This persistent cough may signal serious heart issues, especially in individuals over 50. When the heart does not function efficiently, as seen in heart failure, blood can back up in the lungs, causing pulmonary congestion and leading to difficulty breathing and a chronic cough. Additionally, conditions like pulmonary edema, where fluid accumulates in the lungs due to heart failure, can trigger continuous coughing as the body attempts to expel the excess fluid. Pulmonary hypertension, resulting from elevated blood pressure in the lung arteries often due to left heart failure, causes breathing difficulties and chronic coughing as well. Furthermore, heart valve diseases such as mitral stenosis or mitral regurgitation increase pressure in the lungs, leading to persistent cough and shortness of breath. Coronary artery disease, characterized by blockages in the coronary arteries, reduces blood flow to the heart and manifests as symptoms like chest pain, shortness of breath, and chronic cough. If you're new here, don't forget to subscribe and hit the notification bell so you won't miss any of our health and wellness tips. 3. The sensation of chest tightness. The sensation of chest tightness spreading to the shoulders, neck, back, or jaw is a common and concerning symptom of heart-related issues. Typically, this pain feels like a heavy pressure or squeezing in the chest. It can radiate to other areas such as the shoulders, neck, back, or jaw, and often lasts for several minutes or longer. This could be a sign of angina, where reduced blood flow to the heart due to narrowed or blocked coronary arteries causes chest pain, especially during physical exertion or stress. Additionally, a heart attack, resulting from a completely blocked coronary artery, leads to intense and prolonged chest pain that spreads to these other areas and may be accompanied by shortness of breath, nausea, or cold sweats. Moreover, pericarditis, an inflammation of the outer lining of the heart, causes sharp chest pain that worsens with deep breaths or lying down, and this pain can also spread to the shoulders or back. Furthermore, aortic dissection, a life-threatening condition where a tear occurs in the aorta's inner layer, presents with sudden and severe chest pain radiating to the back, shoulders, or jaw. Lastly, coronary artery disease, characterized by narrowed or blocked coronary arteries, results in angina with chest pain that can extend to other regions, especially during physical activity. 4. Snoring loudly. Snoring loudly and frequently is a common phenomenon, but it can also indicate serious health issues, particularly related to cardiovascular and respiratory systems. Snoring occurs when airflow through the mouth and nose is obstructed, causing the throat tissues to vibrate and produce the snoring sound. This condition can be a sign of sleep apnea, a severe disorder where breathing repeatedly stops and starts during sleep. Sleep apnea leads to low blood oxygen levels, increasing the risk of cardiovascular diseases such as hypertension, heart failure, stroke, and heart attack. When breathing is interrupted, the body works harder to provide adequate oxygen, putting additional strain on the cardiovascular system and raising blood pressure. Structural issues in the airway, such as enlarged tonsils, a long uvula, or a soft palate, can also narrow the airway, leading to consistent loud snoring. These abnormalities increase the risk of sleep apnea and related cardiovascular problems. Early detection and intervention are vital in preventing a heart attack. Maintaining a healthy lifestyle through a balanced diet and regular exercise, managing stress levels, and avoiding smoking can all contribute to better heart health. Remember, prioritizing your heart health and being aware of these warning signs can potentially save your life. Up next, we'll explore a symptom that might seem ordinary, but can be a significant early indicator of heart trouble. 5. Reduced ability to concentrate. Reduced ability to concentrate manifests as difficulty maintaining focus on tasks, easily getting distracted, and struggling to remember information. This condition can cause feelings of fatigue, lack of motivation, and frequent forgetfulness. One primary cause is a lack of oxygen to the brain. When the heart doesn't pump enough oxygen-rich blood to the brain, cognitive function declines, leading to concentration and memory problems. Additionally, heart failure reduces the heart's ability to circulate blood effectively, causing various organs, including the brain, to receive insufficient blood supply. This results in fatigue, confusion, and decreased concentration. Furthermore, irregular heart rhythms, such as atrial fibrillation, disrupt the heart's ability to pump blood efficiently, interrupting blood and oxygen flow to the brain and impairing cognitive abilities. High blood pressure also exerts pressure on the vascular system, reducing blood flow to the brain and causing concentration and memory issues. Reduced ability to concentrate and difficulty remembering information can be significant indicators of heart-related issues, such as low oxygen levels to the brain, heart failure, arrhythmias, and hypertension. Particularly in individuals over 50, recognizing and addressing this condition early can help prevent serious complications and improve quality of life. 6. Morning fatigue. Morning fatigue is the feeling of exhaustion and lack of energy right after waking up, despite having had a full night's sleep. This condition often makes it difficult to wake up, with feelings of sleepiness lingering and an inability to start the day with a refreshed mind. One primary cause is sleep apnea, a serious disorder where breathing repeatedly stops during sleep, leading to low blood oxygen levels and disrupted sleep, resulting in morning fatigue. Additionally, heart failure impairs the heart's ability to pump sufficient blood to meet the body's needs, including during sleep, causing organs, including the brain, to receive inadequate oxygen and blood supply, leading to fatigue upon waking. Furthermore, anemia caused by heart-related issues reduces the oxygen-carrying capacity of the blood, resulting in feelings of exhaustion even after rest. High blood pressure can also disrupt sleep patterns, causing frequent awakenings or poor quality sleep, which leads to morning fatigue. As we explore the critical warning signs of a heart attack, it's essential to understand the underlying reasons for the increasing prevalence of heart issues in populations. Modern lifestyle choices play a significant role, but there's more to the story. Despite medical advancements and increased awareness, heart attacks are on the rise. Especially among people over 50, why is this happening? The answer might shock you. The hidden enemy lies in our everyday habits. From the convenience of fast food to the sedentary lifestyle encouraged by our digital age, these factors contribute silently, yet significantly, to the deterioration of our cardiovascular health. But there's another layer to this issue. One that's rarely discussed but equally critical. Could there be environmental or genetic factors at play that we haven't fully understood yet? Up next, we'll delve deeper into the subtle but vital signs that often go unnoticed. One of these signs might be something you're experiencing right now without even realizing it. 7. Feeling dizzy. Feeling dizzy or fainting without a clear reason can be a significant indicator of heart-related issues. This sensation of unsteadiness, spinning, or impending loss of consciousness, which can sometimes lead to complete fainting, often signals underlying health problems. For instance, low blood pressure can cause inadequate blood and oxygen supply to the brain, resulting in dizziness or fainting, especially when standing up suddenly or after prolonged standing. Additionally, arrhythmias, such as irregular heart rhythms or a heart rate that is too slow, can reduce the blood flow to the brain, causing these symptoms. Furthermore, heart failure diminishes the heart's ability to pump blood effectively, leading to insufficient blood and oxygen reaching the brain and causing weakness, dizziness, and potential fainting. Moreover, coronary artery disease, where the arteries supplying blood to the heart are narrowed or blocked, can lead to reduced blood flow and ischemia, causing dizziness or fainting, particularly during physical exertion. Lastly, a stroke, which occurs when the blood supply to part of the brain is interrupted, can present early warning signs like dizziness or fainting. Next, we'll explore a symptom that might seem unrelated to heart health but can actually be quite telling. 8. Indigestion and heartburn. These common digestive issues can serve as early indicators of an impending heart attack, often occurring up to a month before the event. Indigestion and heartburn present as a burning sensation in the chest or upper abdomen, often accompanied by discomfort, bloating, or nausea. While these symptoms are usually attributed to gastrointestinal problems, they can also be linked to heart issues. the relationship between digestion and heart health is significant, with discomfort in the digestive tract sometimes signaling underlying cardiac problems. People experiencing frequent indigestion or heartburn may be at a higher risk of heart disease. For example, gastroesophageal reflux disease, GERD, has been associated with an increased risk of heart attack. Persistent digestive discomfort can create additional stress on the heart and overall cardiovascular system. Additionally, when the heart struggles to pump effectively, it can cause symptoms that mimic indigestion or heartburn. Such disturbances can lead to chest discomfort, which is often confused with digestive issues but can be a sign of an impending heart attack. 9. Shortness of breath. Shortness of breath can often serve as an early indicator of an impending heart attack, potentially occurring up to a month before the event. Experiencing difficulty in breathing during normal activities or even at rest is a significant red flag. This symptom presents as a sensation of not being able to catch your breath, feeling winded, or struggling to breathe deeply. While shortness of breath is often linked to respiratory issues, it can also be a critical sign of underlying heart problems. People who frequently experience shortness of breath are more likely to develop heart disease. For instance, heart failure, where the heart cannot pump blood effectively, often leads to fluid buildup in the lungs, making breathing difficult. Additionally, conditions like angina or a heart attack can cause a sudden and severe shortness of breath. When the heart's function is compromised, it fails to deliver enough oxygen-rich blood to the body, leading to breathlessness. This condition strains the cardiovascular system and can significantly impact daily life and overall health. 10. Excessive sweating. Excessive sweating, particularly cold sweats, can be a crucial early indicator of a heart attack that may occur up to a month before the actual event. Cold sweats manifest as sudden and unexplained sweating, often accompanied by a feeling of clamminess or dampness. Unlike regular sweating, cold sweats can occur without physical exertion or an increase in body temperature, making them an alarming sign to watch out for. During a heart attack, the body's autonomic nervous system reacts to the decreased blood flow and oxygen levels by stimulating the sweat glands. This response can lead to profuse sweating as the body tries to maintain a safe core temperature despite the reduced oxygen supply to the heart. Interestingly, a study published in the journal Circulation found that over 40% of heart attack patients reported experiencing unusual sweating as an early symptom. It's not just about feeling warm, it's about your body reacting to serious stress due to impaired heart function. This type of sweating often appears at rest or during minimal activity, indicating your heart might be struggling to pump blood effectively. So there you have it, the 10 signs that could indicate heart disease up to a month before it happens. Which of these signs surprised you the most? Do you have any other symptoms we didn't cover? Sharing your story below could provide insights and encouragement to others navigating similar paths. If this video has provided you with valuable insights or reinforced your current health strategies, please show your support by hitting the like button, subscribing to our channel, and clicking the bell icon so you get instant notifications whenever we upload new videos. Remember, your health is in your hands. Thank you for watching. Stay vigilant, stay informed, and here's to your heart health and overall well-being.